This is the video on how PET, SPECT, and DTI work. PET, or positron emission tomography, uses radioactive atoms to depict activity in the brain. Certain atoms have strong binding affinities to chemicals that the body naturally uses. These radioactive tags can bind to those substances and create radionucleotides. PET uses a large scanner to detect the locations of those radioactive particles emitted by radionucleotides to look at different functions. For example, when bound to glucose, a radioactive atom of fluoride forms fluorodeoxyglucose, FDG. And since the brain metabolizes glucose, the radioactive particles are picked up by the active areas of the brain during a given task. The radionucleotide attached to the glucose can be picked up by the scanner and show the area of the brain that used the glucose. Essentially, the tags are inserted intravenously, and as the radionucleotides break down, positrons are emitted. Positrons have about the same mass as an electron, but contain an opposite charge. When positrons interact with electrons, annihilation occurs, resulting in the release of 2 photons. Computation is then used to take the locations that give off the most photons and make them brighter, while less active areas stay darker. Maps are then generated over the tissue in question to show the different function levels. Single photon emission computerized tomography, or SPECT, is also a good way to bioimage different parts of the body to show functionality. Similarly to PET, SPECT is a kind of nuclear imaging test, so it uses radioactive substances. When it comes to SPECT in the brain, it is useful for seeing regions impacted by dementia, as well as seizure foci in epilepsy and clogged blood vessels. In a SPECT scan, patients also receive IV injections, and it contains a radioactive tracer. Tracers decay in a similar fashion to the ones used in PET, but they result in gamma waves being emitted rather than photons. A gamma camera then detects these and uses computation methods to render functional images. DTI, or diffusion tensor imaging, is much newer and focuses more on identifying white matter tracks in the brain. It does this by tracing the orientation and uniformity of water diffusion. Water molecules in white matter sit perpendicular to the fiber tracks, meaning the orientations of these tracks can be traced. By applying diffusion gradients in more than 5 different directions, a diffusion tensor, or 3x3 matrix, can be calculated per pixel via eigenvectors. The white matter fiber's direction is then shown via color-coded vectors that show position and direction. By tracing water diffusion, the entirety of the white matter in the brain can be traced, and abnormalities, or degradations, can show underlying causes, from schizophrenia to psychosis or bipolar disorder. Interactions between the hemispheres via the corpus callosum can also be tracked. This ends the video on PECT, SPECT, and DTI.